Breast cysts do not need to be operated on. No surgery is required for breast cysts. Breast cysts cannot be biopsied.
Another topic about breast cysts. This is also very common. Is there a better approach for this? Because when patients go to different doctors, they get confused. One wants to operate, one does want medical just management.
Okay, let me be very clear. All right, breast cysts do not need to be operated on. I say it one more time. Breast cysts do not need to be operated on. As long as you say the word is a breast cyst, no need to do any surgery. In actual fact, that's the main distinguishing factor. When we do an ultrasound of the breast, we distinguish between those that are solid lesions and those that are liquid. Solid, you have to pay careful attention. It can be benign nodules like fibroadenomas, all right, or it could be something more ominous like a carcinoma. But when it's a cyst, that one you rest assured, no surgery is required for breast cysts.
How about biopsy?
Breast cysts cannot be biopsied. Breast cysts can be aspirated. You can put a needle in. Sometimes patients complain of very painful breasts because the cysts are engorged. They're full of water. And many of these patients who come to see me, I don't even send to the surgeon because it's so simple. I just stick a needle, suck it out. You know, if I want to be very careful, I send the cytology just to prove that it's not cancerous. But 99.99% it is not cancerous when it's a cyst. That's why it should not be operated. Now, if it's a solid lesion, that's a little bit different. You have to look at the features of the ultrasound. Some of them are very clearly benign looking. They do not require any surgery. But if there's any suspicion, you can always do a needle aspiration to see whether they're cancer cells. This can be done very simply in the clinic, does not require anesthesia, nothing at all. And it's literally a 2-minute procedure.
How about the BIRADS staging?
The BIRADS is usually used, is more applicable when you're talking about the BIRADS on a mammography. That's not on an ultrasound. And that's often referring to the BIRADS of the solid lesions.
Yes.
Cysts, generally, we just say these are benign cysts. We don't give it a BIRADS rating.
So you don't say if it's more than this BIRADS?
Well, BIRADS is a general classification. 1 and 2 are definitely benign. 3 needs further observation because of certain features. 4 is very suspicious. 5 is confirmed. This is mammographic screening. Okay, so it's very important in that situation to look at the mammography in order to determine whether further biopsy is necessary.
This is the difficulty of patients. When do they need to go for a second opinion? Okay. Do everybody need a second or a third opinion?
That is a very, very difficult question to answer. I mean, very often, a patient comes to see a doctor because he trusts. There must be a certain element of trust. Use yourself as an example. You came to see me. You saw me. I gave you an opinion. You felt that the way I presented it was logical and you were agreeable. I don't think after you saw me, you went for any second opinion. You came to me, you listened to what I had to do, you saw what I was doing for you. I mean, yours is a very classic case. You didn't go for a second opinion. And I think that we have worked well together as a team and we've been able to help you to get better.
Thank you so much, Dr. Ang.